Our next guest is hopeful his research holds the key to preventing suicides. Zachary Kaminsky says it may be possible to predict whether a person is at risk of suicide simply using a blood test. He's joining us from Ottawa this morning to chat more about his findings. Good morning to you. And just before we begin, I want to bring up some statistics for our viewers. Here in Canada, on average, 11 people a day die by suicide. It is the second leading cause of death for Canadians between the ages of 15 to 24 years old. And the rate of suicide attempts among women is 3 times that of men. So if you had, Zachary, a clinical trial up and running in the next few years, how would you be able to use this blood test to determine whether or not a person was at risk?
Well, good morning. It's a pleasure to be here. Thank you very much. Well, we're hopeful that we'll be able to use this blood test to predict, to see who will be at risk. But there are a lot of questions that we also need to answer as we proceed with research with this. We need to understand how this can change over time. For example, whether this blood test will predict someone's risk going forward for years to come, or if, for example, when someone gets well again, they're no longer thinking about suicide or exhibiting suicidal behavior, does the marker change as well? And understanding that is going to really be important for allowing us to understand how to best work it in with clinical practice, to make a tool that will help doctors make clinical decisions.
So a key component of your research is finding the gene that is linked to stress reduction. Why is that so important?
Well, the suicide field has known for a long time that stress is a precipitator of suicidal thought. So what we think is important here is that the gene SCA2 and this epigenetic switch, that's a switch that turns the gene on or off, results in what we call basically a stress diathesis, or a biological vulnerability. And so it's almost like a brake pad that is worn thin. And if your car is parked in the driveway and you have a thin brake pad, you may never notice. But once we're stressed, once a major life event happens, then all of a sudden you'll notice that this brake pad is too thin. And so then the low levels of the SCA2 gene, which helps to modulate the stress response, may let us realize that there's a problem. And this will lead to potentially suicidal thought.
Would the findings not change depending on when in your life that you're taking this test?
Well, that's a question that we need to answer. It's important to consider that we've looked at a number of populations when we first found this. This included post-mortem brain tissue in older individuals, but also people in the middle of life, as well as then we looked in the blood of some adolescent cohorts. And we found consistent findings across all of these cohorts, which gives us hope that the test, the eventual test, might work on pretty much everybody. But that's something that really needs to be vetted before this becomes a clinical test. I should point out that this is still in the research phase. You can tell from my answers that we have a lot of questions to answer, and that's part of what I'm going to be doing here at the Royal Institute of Mental Health Research, affiliated with the University of Ottawa.
You know, you've said that you think the military is a good place for this test to be used. Why do you say that?
Well, I think one of the reasons why the military could be a good place to start is that in someone's life, we don't necessarily know when a stressor is going to happen, but that's not necessarily the case with the military. We know that deployment to active military situations is going to be highly stressful. And so we have the two components that we might need. We can test the biological vulnerability in the context of a deployment, which will be a stressor. And then we also know when to monitor for symptoms when people return or potentially out in the field. So I think that that's a logical place to really answer some of these questions to start with.
All right, so many more questions, but as you say, you are early in your research. Zachary, interesting to talk to you this morning. Thank you.
Thank you very much.